the role of different government levels, and the influence. Nigeria has the largest number of under 5 and maternal deaths in the world. Under 5-year-olds and maternal deaths in the world, and it's not correct. The comment goes. Health outcomes are poor not just in absolute terms, but obtained compared to one largest oil producer, but its spending on health as a percent of GDP is second lowest in the world. In response to these challenges, Nigerian policymakers have put forward important health initiatives over the past decade, including National Health Act, primary health care programs such as Saving 1 Million Lives program, and National Health Insurance Authority Bill of 2022. The following constitute key aspects of health policy formulation in Nigeria: competing interests, political will and commitments, influence of private sector, social and economic factors, multi-stakeholder involvement. All these competing interests have slowed us down. The next topic that I'm going to talk about is national drug policy. Drug includes any substance or mixture of substances manufactured, sold, or advertised for use in the treatment, mitigation, or prevention of any disease, disorder, abnormal physical state, or the symptoms thereof in man or animals, restoring, correcting, or insects or pests, or contraception. That is the wide definition of drugs. The National Drug Policy for Nigeria, third edition, was released in 2021, was adopted and launched actually originally in 1990 against the background of inadequacies in drug availability, supply, and distribution. Some of the factors that necessitate the formulation of the NDP at the time are as listed: ineffective system of drug administration and control, inadequate funding for drug supply, high dependence on foreign sources for feeding drug products, pharmaceutical raw materials, reagents, and equipment, lack of political will to provide safe, efficacious, and good quality drugs to meet the health needs of Nigeria. The policy was formulated with laudable goals to address unsatisfactory situations. Primarily, NDP goals centered on always making available to the Nigerian populace adequate supplies of medicines that are of quality, effective, affordable, ensuring the rational use of such medicine and stimulating increased local production of essential medicines. Its adoption at the time was seen as positive, and strategies for implementation were put in place. Sadly, some of the factors that necessitate the NDP persist, and these and other areas should constitute the focus of our young pharmacists, particularly those that are in government, at the federal, state, or even grassroots level. The third topic I'm going to talk about is legislation. Legislation serves as the instrument of implementation of drug policy. Legislation gives legal effect and enforceability to policy by transforming goals into legally binding rules. It also defines the qualifications, duties, privileges, and obligations of individuals, organizations, institutions, and other bodies. One policy outlines desired outcomes and strategies. Legislation provides the framework of laws and regulations needed to achieve such. Essentially, legislation is the mechanism through which policies become operational. Policies, whether formulated by governments or organizations, establish the goals, objectives, and desired direction for a specific area. They serve as roadmap for action, outlining what needs to be achieved. Legislation, on the other hand, gives force to these policies. Without legislation, policies will remain aspirational goals without the power to compel action. Now coming to medicine security. In general, medicine security encompasses a range of factors. Accessibility, availability, affordability, acceptability with regards to essential medicines. Medicine security is the reliable and equitable access to safe, effective, and affordable medicine. Is closely linked to the United Nations SDGs, particularly SDG 3, good health and well-being. It is a crucial component of universal health coverage. In Nigeria, more of the medicines in use are imported. We have decreased it from 70% to 60%. It was about 70 7 years ago. Now it's about 60%. But nonetheless, this also still makes country vulnerable to supply chain disruptions and price fluctuations. The narrative in the past was that the 70% of all medicines were imported. All of that is changing, as I mentioned, with our 5+5 policy and the introduction of the NAFDAC ceiling list. Any drug under that ceiling cannot be imported into the country. And for 5+5, for those that don't know, if we have given you 5 years of renewal forever, and our own manufacturers can make shots locally, we will give you the last 5 years, that during which rather you will migrate to local manufacturing or collaborate for partnership. We did that 2019, and now it has changed the ecosystem. The 5+5 has changed the ecosystem. We now have more manufacturers that are new, that have expanded their facilities. Recently, the National Pharmaceutical Ceiling List was updated to 36, which means that none of these, like I mentioned, products could qualify for renewal or for importation. Medicine security could be mentioned without reference, could hardly be mentioned without reference to substandard and falsified medicines. You all saw what we did in February, March of this year in Idumota, in Aba, and Onitsha. Substandard falsified medicines pose a serious threat to medicine security by undermining public health, eroding trust in healthcare system, and potentially causing harm to patients. It's not potentially, it causes harm to patients, it increases morbidity and early death. The agency has adopted some measures to combat the scourge of excess, along with Pharmacy Council of Nigeria. And one of the goals is for PCN to ensure that coordinated wholesale centers are in place in the 4 cities first: Kano, Lagos, Aba, and Onitsha. The Kano CWC is already there, the Kanawa wholesale center. Lagos is being built as we speak. Onitsha is in the initial process. Aba is about to commence, they're still planning. But the goal is to actually have this 2 others in other geopolitical zones. And with what NAFDAC is doing, with track and trace, we're going to introduce GS1 driven track and trace system to monitor the pharmaceutical chain, supply chain. We will also use detection devices, such as blue scan technology, to monitor what is out there. With the advent of the CWC's open market operations, such as Idumota, Lagos, Aba, and the Mr. Bridget, will be a thing of the past. That is part of what we are working towards along with PCS. At the completion of the CWC in Kano, the open market that was in operation has since been relocated to the Kanawa Center. The federal government is putting all the measures in place to ensure it. The presidential initiative on unlocking healthcare value chain feedback is a strategic government effort aimed at transforming Nigeria's healthcare ecosystem and establishing the nation as a global hub for medical products. Inaugurated in October 2023, PIVAC has its major goals: the boosting of local manufacturing capabilities for pharmaceuticals, medical devices, and healthcare technologies. The pharmaceutical industry of a nation is as strong as the regulatory authority. When the national regulatory authority is strengthened, the industry is strengthened. This is what has led to enhanced local manufacturing and ultimately medicine security. NAFDAC has attained the WHO Global Benchmarking Maturity Level 3, a level that signifies that the agency is a stable, well-functioning, and integrated regulatory system. It is not a one-off attainment. We have to keep at it. And we are proving that we are keeping at it. But we want to make it a legacy pathway to medicine security. At NAFDAC, the goal is to attain maturity level 4 and the WHO listed authority. This status will no doubt further enhance medicine security in the nation, and we are very much on course to reach that goal. It's not just making medicine security a sure thing in the nation, it is also placing Nigeria as an exporter of medical products to the rest of the world. That's where we are going. What is the role of the young pharmacist? The role of the young pharmacist in medicine security cannot be overemphasized. The role cuts across active participation in politics. Somebody has mentioned that this morning. Policy formulation and governance. Young pharmacists are uniquely positioned to impact medication safety at the individual patient level, promote proper medication use, and contribute to system-level improvements. Young pharmacists can also influence policy through professional organizations and by participating in public service. Here are some specific areas where young pharmacists can make impact in politics, policy formulation, and medicine security. They can participate in professional organizations, I've mentioned that, and PSN, FIP are examples. This group provides platforms for networking, professional development, and leadership opportunities, enabling young pharmacists to share knowledge, learn from each other, and contribute to positive change at various levels. Another means of involvement is engagement in policy-making processes. Young pharmacists can contribute to the development and implementation of public health policy by providing expert advice, conducting research, and participating in relevant committees and forums. Representation in government structures, or governance structures, sorry. There's not enough representation by the youth in governance. Young pharmacists can seek representation in relevant governance structures such as pharmacy councils, regulatory bodies, and government agencies. That is what NAFDAC is doing, as I'm going to explain very shortly. This will ensure that the perspectives and concerns of young pharmacists are considered in decision-making processes. Of course, they can also participate at the individual patient level through medication therapy management to identify, resolve, and prevent medication-related problems, including adverse drug events. At the patient level, young pharmacists can also carry out so much activities as patient counseling and education, medication reconciliation, pharmaceutical care activities, all geared towards enhancing medicine security. What of at the system level participation? At the system level, young pharmacists can contribute to reduce the antimicrobial resistance by promoting appropriate antibiotic use through antimicrobial stewardship, medication safety programs, adverse drug reactions, and the education of other healthcare professionals on proper medication prescription and dispensing. What of young pharmacists and NAFDAC? We have been involving young pharmacists in NAFDAC to assist, to join hands with us in substance abuse among youth. This remains a critical public health challenge with rising cases of tramadol, codeine-based syrup, cannabis abuse among adolescents. The World Drug Report 2023 highlights a global surge in synthetic drug abuse, while the National Drug Use Survey of 2018 estimated that about 50% of Nigerians ages 15 to 64 engage in illicit drug use, with youth disproportionately affected. That was why we NAFDAC started the Youth Against Drug Abuse, YADA, with young pharmacists, YPG, taking the lead. This was quite long in 2018, and we carried it through until the pandemic. It was designed as a school-based drug use prevention initiative, targeting secondary school students and their parents. The 2019-2020 pilot phase, though promising, faced bureaucratic delays, COVID-19 disruptions, and volunteer attrition, impacting program execution. However, it provided critical lessons and insights that now inform the revitalized YADA Phase 2 initiative. NAFDAC is funding Phase 2 initiative being led by Pharmacist Yeduni Adenuga, Director, Narcotics and Controlled Substances of NAFDAC, and YADA is being launched today in Kano. Mr. President, YPG, visited in Abuja. That visit also led to the decision to kickstart the YADA project that is going to be launched today. In addition, we have initiated what is called the YPG Pharmacist Reserve Program. We can call it YPG PR. It will be a group of working young pharmacists that will be trained by NAFDAC in different regulatory programs, and the group will be called to action from time to time. Again, this is a group of working young pharmacists. That's why we call them Pharmacist Reserve. This initiative will be launched on July 29, 2025. So this encapsulates what I've been talking about in terms of how young pharmacists can get involved at the governmental level, at the individual level, like they're going to do through YADA. In conclusion, providing our citizens with fair and equitable access to healthcare remains one of the most challenging issues facing most African countries. By actively engaging in various avenues, young pharmacists in Nigeria can make a significant contribution to the governance in the healthcare system, thereby enhancing medicine security and promoting better health outcomes for all. Thank you very much and God bless.
IPG, PSM. Thank you so much, Professor Mojisola Adeye Christiana, for doing justice to the theme, pharmacy, politics, and pills.
I hope I was heard.
Very loud and clear.
Hello?